In recent years, there is an increasing need for eye care among the many patients, especially the elderly. Basic eye care is provided to people who have not had access to eye care before. Eye infection, vitamin A deficiency, and minor injuries are treated here on a bi-weekly basis. Vision testing and eyeglass distribution are also major activities. More than 200 patients are treated here every month.
The children are missing more than you like. Sunday, the man look better on me and do pure. The children are missing yard at Kaide, then they say good up be like there. The Palaja at the low yoga plow. I don't do pure at the end.
This highlights the big problem of this area.
Twice a year since 2002, a small eye surgery team visits from the United Kingdom to treat injury cases, glaucoma and cataracts. In one 2-week visit, they successfully perform up to 200 cataract operations. Over the years, they have restored sight to thousands of people who cannot afford to live without it.
So since our health service is growing, we need many experts. Like we need a technical expert from obstetric, gynecological, surgical problems, pediatrician, public health, as well as some English training, computer skill. So the international community are very supportive, especially the health professional.
It looks better. This is a 20-day-old baby that was born at home, and after 3 days ago, 3 days prior.
Many young internally displaced women and migrant women lack reproductive health knowledge, and their use of contraceptives is low. In addition to unwanted pregnancies and unsafe abortion practices, these young women are particularly vulnerable to sexually transmitted diseases, including HIV infection. The Reproductive Health Department accounts for 24% of the clinic's workload and handles over 2,000 visits per month.
And the Reproductive Health Department provides antenatal care, family planning, labor and delivery services, and management of sexually transmitted infection, emergency obstetric care, and emergency obstetric referral, and medical and counseling for the victim of sexual gender-based violence.
This department also acts like a safe house for survivors of sexual and gender-based violence and for women seeking support with unwanted pregnancies.
So in this area now we have 13 beds. There are 13 beds, so for sure we separate two parts. One part is for the gynae and pregnancy with other problems, and the other side for the post-abortion care. But sometimes because of we have the problem with the space, we keep all together. So most of the cases that we have seen in the reproductive health department are the pregnancy with malaria. It's the main problem. And the second one is the post-abortion care client.
Many young women arrive at the clinic with fever and infection after failed home abortion attempts, so the clinic has increased family planning counseling for medics and the community, and it has a sound post-abortion care service.
For the post-abortion care client and other gynecological problem. So if we have in a case like that, we do examination here, and we do also manual vacuum aspiration procedure. Normally for the post-abortion client, they use to do induced abortion. So they insert this kind of stick in their cervix. Sometimes they use the some contour wool, yeah, to induce abortion also, and they also use other traditional medicine. They normally call like kiripan or something like that, yeah, and they do massage in their uterus. Yeah, there is a delivery room. We have 2 delivery bags. We have 5 delivery per day average. 5 delivery per day. We manage some complication in here. We can manage here. But for example, if we need like a cesarean section, so we cannot do here, so we refer that case to Mae Sot hospital. There's some complication like prolonged labor and assisted vaginal delivery as a vacuum delivery, where we provide here blood transfusion and use of oxytocin. Yeah. So, and for post-abortion care, like manual vacuum aspiration or DMC, that we perform here.
Malnutrition, malaria, and other infections contribute to complications during pregnancy. Many of the 160 babies born at the clinic each month are premature, and about 15% are below the normal birth weight of 2.5 kilograms. For new parents, the clinic provides health education and child health services. The medics instruct parents on proper child nutrition and specifically on diarrhea prevention, oral rehydration therapy, breastfeeding, supplementary feeding, and the importance of immunization. The reach of the Mae Tao Clinic extends far beyond its base in Mae Sot. The clinic supports backpack health workers and mobile clinics serving Burma's internally displaced peoples. The clinic's community service programs include a boarding home at Ompia Mai refugee camp for unaccompanied children and a school health program for 3,000 migrant children aged 5 to 14 in 35 migrant schools. In addition, the clinic sponsors women's organizations, health education and community awareness events, and cultural celebrations, both at the clinic and in refugee camps.
This clinic is not only providing health service. This is home or school and also social welfare service for many of us. Many people who fled to the border and separated from the families, and a lot of psychological trauma. So through the clinic social service program, also training program, as well as living as a community, we can identify the problem and we can support each other. So here at the clinic, the young people have opportunity, as well as there are many Burmese community in Thailand have opportunity to share our knowledge, experience, and to identify the problems in Burma. At the same time, we have opportunity to share our culture and to build the capacity of people to strengthen and to support each other.
Dr. Cynthia Maung's Mae Tao Clinic is not formally recognized by the Royal Thai government, and the clinic staff cannot be registered as migrant workers under current government policies. Although the clinic coordinates closely with the Thai Public Health and the Mae Sot Hospital, the relative safety of the migrant patients is still not ensured.
I feel very sorry for the patient because we can't do for the patient anything. Only we can have that little bit. Yeah, I would like to have more, but I can't. because of the situation. And also we are here, we are illegal also. We don't have a chance to do anything.